Today, there are more than 900 genetic tests for a variety of diseases, potentially overwhelming, right? So what do you need to know? Joining us from Chicago to share helpful insight, Dr. Gail Vance, a pathologist and a clinical geneticist specializing in cancer genetics for inherited diseases. Good morning, Dr. Vance.
Good morning.
So with the recent advancements in genetic testing, what are the questions that we as patients should be asking our doctors?
Well, recent advances in genetic testing have made it very difficult for patients to stay up on this information. There are more genetic tests now than there ever have been in medical history. What's important to know, though, for the patients is that there are different kinds of genetic tests. Some that will determine inherited predisposition to disease, and other genetic tests will identify mutations in a tumor or a cancer. And it's important for patients to know what genetic test is appropriate for their health care.
The Angelina Jolie case from last year, I think, elevated this for a lot of people and made it more of a priority. Would you explain why it's important for a pathologist to be involved?
Yes, the Angelina Jolie story, having such a celebrity come forward with the dilemmas that she faced about testing and then what to do with those test results, was really important, and it brought a lot of people to their physicians to ask about this genetic testing. With regard to pathologists, pathologists are physicians that are involved in all aspects of healthcare. They run the laboratories that perform the genetic testing, and they make sure or assure that the testing is done accurately and safely. Also, it's very important to interpret the test in light of the patient's family and medical history, and the pathologist does this and shares that information with the patient's treating physician or directly with the patient.
How affordable are these tests, and is there ever a case where they're covered by insurance or healthcare providers?
That's a very good question. There are so many genetic tests that it's important to understand what genetic test is appropriate for the individual. Once that's been identified, it's determined how much that test costs. The BRCA1 and BRCA2 genetic tests that Angelina Jolie had performed can range anywhere from $2,000 to $4,000. So depending on the genetic test, it's important to understand how much it costs, and then to talk with your healthcare insurer and find out if your insurance company will pay for these tests. And your physician can help you with this.
As we talked off the top, 900 tests here, and so this idea of the volume of information that must be available, is there a single site where you would send our viewers to learn more about genetic testing and some of the things we've discussed here today?
Yes, that's also a very good question. There's a vast amount of genetic information available. One of the websites I would direct patients to is the cap.org website, where we'll have information on genetic testing related to this segment. There's also a website for the American Cancer Society, but I really would refer individuals or your patients to their own physician to discuss the risks and benefits of the genetic test, what it will and what it won't determine for them and their health care.
And in Angelina's case, she said the family history was there and she wanted to do everything she could to make sure she was around as long as possible to be a mom and a wife. Thank you, Dr. Vance.